This is just a short video on macular holes. So as the name implies, a macular hole is a hole in the macula. The macula, again, is the part of the eye that is responsible for the central part of your vision. So your peripheral vision, which is not really good actually, it kind of is good at sensing motion, but for reading, recognition, seeing faces, all your central vision, it is in the macula. And a macular hole is a relatively common condition, and that is when you get a very small little hole right in the center of your fovea. Normally around to 200 to 300 microns. They can be bigger than that, but we're talking about a really small hole. Now, technically, it's not literally a hole, and normally what one would consider a hole is when tissue is removed or torn or opened up. With the macular hole, essentially what happens is the retina in the center splits, so it pulls away from the center and it leaves a gap or a hole in the center. So I've got some images I'd like to show you just to give you an example. So over here, this is a normal fundus, just to orientate you. And this central area here is what we would refer to as the macula. And macular holes typically happen right in the center. So this patient doesn't have a macular hole. They have got a normal macula. So here's an example of a macular hole. So you can see right here in the center of the retina, there is a hole. This is typically what it looks like. That's a hole. And this is on a fundus photo. Here's another example of a very large hole. But normally the way we look at these, it's not obviously by looking at it at the slit lamp and fundus photos, but more commonly we look at it on OCT. So what an OCT is, it's an essential tool in an ophthalmology practice, and what it does is it images just this part here. So normally the image is orientated this way, and you can see the layers of the retina from outside to inside. There's 10 layers of the retina, and there's the choroid underneath that and the sclera. So we image this little section here. It's like taking an image just of that section there. And so that's what these images here are. So let me just show you. So here, where do we find? So this is an image of the retina, and this is essentially a typical macular hole. It's very easy to see on scan. You can see this is inside the eye, this is outside the eye, and these are the layers of the retina. And you can very easily see that this retinal continuity is lost, and there's a hole over there. So this is just another example here of a macular hole. There we go, there's another example, and that's what a macular hole looks like. This is before and after surgery. So the way we manage macular holes is with surgery. So how do we treat macular holes? Unfortunately, medication, eye drops, etc. aren't going to be. So this can't be treated medically. It has to be treated surgically. Without surgery, the hole will not close, and so surgery is really the only option. Now, there's a whole lot of factors which we won't go into now in terms of assessing, what is the chance of good vision, what is the chance of hole closure, etc. And there's certain features that we use to prognosticate the chance of a hole closing and give an idea of whether the vision will improve. Without surgery, what happens is that hole in the center, you cannot see in that hole. And the larger the hole, the worse the vision is right in the center. And because it's dead center in the middle of the vision, it's obviously very disruptive to the vision. And so what is required is a vitrectomy surgery where we remove the gel from the back of the eye. So we need to go into the back part of the eye and we do a vitrectomy where we remove the gel. And once we've removed the gel, we can then access the macula, which is at the back of the eye here. There's a variety of techniques that we use. Most of the time, or almost always, an ILM peel is done where we peel a very thin membrane off the back of the retina. That's called an internal limiting membrane peel. There's certain flaps that we use as well, and sometimes there's other things that we use like OptiStim, amniotic membrane. There's a variety of other options for holes that are large or recurrent holes. And then importantly, post-operatively, after most vitrectomies, but especially after macular hole surgery, is a gas tamponade is put in the eye. And what that means is that we put a bubble of gas in your eye. So instead of this component of your eye being filled with gel, the gel's been removed, we fill it with gas, and so it's filled with the bubble. And because the macular hole is at the back of your eye, we want the gas bubble to push up against the back. So if your eye is in the normal position, like I'm sitting here, if I'm sitting here, my eye's in this position, the gas bubble will float up and push up. So it'll push up in this part. Now your macula's at the back of your eye. So to get the bubble to push up against the back, the way we do that is we ask you to position your head in the downward position. By positioning your eye down, the gas bubble in the eye pushes up, and it pushes up against that hole where the surgery was done, and that assists with closing that hole. So we call that face down positioning, and depending on the size of the hole and the risk, we will decide on A, what gas to use and how long that gas lasts for, and B, how long to position for. So that's important to understand. Post-operatively, there may be some face down posturing required. So here's just a great image just to explain it as well. Here's the eye in the face down position, and here is the gas bubble that's pushing upwards, and it's pushing up against where that macular hole's to assist it with closing. So that's the basics of what a macular hole is and how it's treated. And if you need any more information on this, please feel free to contact us.